Well, hello. And again, it's another episode of Let's Chat Health Tech. And today we've got the great pleasure of having Chris Grasso with us. And Chris is a healthcare technology exec. She's been in the business for 30 plus years, including 20 years at a federally qualified health center, which we'll talk about because it's particular interest to me, partly because it's a little bit outside of the normal healthcare delivery model. Chris, welcome. Let's dive in.
Yeah, thanks. Thanks so much for having me. I've been looking forward to this conversation and talking about all things related to technology and healthcare. So, just a little bit about who I am, and I'll tell you a little bit about FastX. I've been working in healthcare, nonprofit space, really most of my career, about 30 years now, and spent about more than 20 years at a federally qualified health center. And during my time there as a CIO, I had the privilege of working with a lot of health centers across the country. I work with National Association of Community Health Centers, HRSA, various organizations, and got to really see what was happening across the country and just got to see all the amazing work that was happening, all the fabulous clinical care. But one of the things I kept seeing was that the challenges that many health centers were facing because they didn't have a technology leadership, that executive strategic leadership. And sometimes it was because they couldn't find the talent locally. Sometimes it was because they couldn't find it. And I'd always have these conversations with the federal folks and say, you're doing all this work around workforce development, trying to get clinicians to stay in health centers, but you're not doing anything to develop the workforce around technology. And like, if you don't develop that, we're going to lose people, right? We're going to lose clinicians. We're going to lose therapists. And they were just like, yeah, that's a nice idea, right? And kind of move on. And so after I went through my successful implementation at Fenway, after being there for 20 years, felt like a good time to close a chapter and move on. And then that's where I decided to sort of take the matters into my own hands, so to speak, and spin up my own company called FastX Partners to really sort of address that gap. And so FastX basically stands for F is for fractional, A is for AI, S is security, T is technology, and X is everything else. And when I originally started it up is really obviously focused a lot around technology, but as I thought more about it, and my experience with health centers is really when you go in, they just need technology support. Oftentimes, there's a lot of other areas where they can use some support. And so the X was really around kind of everything else that we could bring to the table. And I quickly also realized that there's a lot happening around AI and a lot of support that health centers needed. And so I had some previous experience working with natural language processing many years ago. And so I had exposure to it. And so we started to get some interest from organizations really wanting help figuring out like how to suss through this maze and all this new things that are coming out around AI. And so that's when we really started our AI business line as well as consulting too.
Okay. So as I mentioned at the start of this, the federally qualified health centers, FQHCs, are particularly intriguing to me, partly because they're a little outside the typical hospital health plan milieu, number one. Number two is I have a current client that's selling to them. So if you could, for the audience, kind of explain in a few sentences what makes the FQHCs particularly interesting. There are a lot of them out there. They're delivering care for a certain constituency. Tell us a little bit more about them at a high level.
Yeah. Well, there's about more than 1,400 health centers across the U.S. territories caring for millions of people annually. And a lot of them operate on a very limited budget. And so they have to be very careful with their resources and the products that they bring in. But all the more reason why they're really good candidates for technology that can help them, right? And help offload some of that work and really help augment some of their staffing. So I think one of the biggest mistakes vendors often make when they're thinking about selling into FQHCs is that they just think they're smaller hospitals, right? They're not, right? They're very unique and complex businesses in that kind of way. And so I think that's one of the big areas that really kind of gets people into trouble.
And how are they organized? How are they structured? And what are the big drivers for them? Like if you're selling into a FQHC, what is it that will resonate with them? What sorts of things will resonate?
Yeah. So for them, I think the big thing that it comes down to is like, don't show me what your product can do.
Yeah.
Show me how you can help solve my problem. Right.
Yeah.
And that's where I think there's the disconnect sometimes between vendors and the health centers. Right. And I've sat in a number of, we could get into this, but I sat in the implementation on both sides of the table, so to speak. Right. I've been on the CIO side and now I'm on the vendor side. Right. So I see what happens and I'm in these meetings and with health centers that I'm working with, and I could see the glaze over, right, from vendors when they're presenting, and I'm like, oh boy, this is not going well, right? So, and I think that's one of the biggest gotchas, I would say.
Okay.
Yeah.
And then just to stay on this for just another minute, what drives them in terms of like revenue? How do they make their money or how do they get paid for their services? And who are their patients or customers? Who are they?
Yeah. So great question. So a lot of them serve very underserved communities. So folks who maybe are uninsured or underinsured, a lot of Medicaid patients, a lot of uninsured patients, Medicare. They do serve a private payer population, but it tends to be on the smaller side. And I think a lot of health centers are trying to change that. But they basically serve everywhere, as I say, the saying goes cradle to grave, right? So everywhere from OBGYN at delivery, right, to births, but they take care of everybody from infancy on up through elderly population and everything kind of in between and provide all that sort of primary care, wraparound services, behavioral health services,
Yep.
dental optometry,
Yep.
pharmacy, et cetera, et cetera. And so many of them also have a lot of additional specialty type practices, but they tend to be in areas that are underserved or even in rural environments, right? Where maybe there's no other hospital or healthcare organization around for many, many miles. So they really fill an important gap. And sort of think of them I think of them as the backbone of primary care in the
Right.
US.
Yeah. Well, 1,400 plus locations, that's substantial. And so what that immediately, when I think of that, when I think of Medicaid and I think of a lot of rural settings, I'm thinking the big beautiful bill and how that's gonna impact FQHCs and thus and other like rural hospitals and clinics. Like any thoughts on that? Because I think one of the things I always try and emphasize with my clients and I think it's like fundamental to when you're selling this, like how do they get reimbursed? How do they pay for themselves? How can you contribute to that in a positive way? So like what are your thoughts on this? Which basically starts to really hit in what, November, December of this year, right?
2027. Close
Is
enough
it
though. Yeah.
oh
Close
oh it
enough.
is? Oh,
Yeah.
okay. I thought it
Yeah.
was
It
close.
goes into effect, yeah, in 2027.
Okay.
But a lot of some places are obviously already preparing for that. And I think there's one state out in the Midwest is already sort of operating as though it's in effect, right? To try to sort
Yeah.
of prepare for that.
Yeah.
But it is going to have a tremendous ripple effect across the FQHC environment because they have so many patients who
Yeah.
are on Medicaid
Yeah.
and the requirements around that. And people, I could tell you from the leadership perspective of health centers, people are extremely worried about that. And many of them are trying to think about preparing now. Like, what can we use and what technology, what products can we put in place to help manage this? Because you're not going to be able to throw enough bodies at this to try to really manage keeping people insured and try to make sure that people are submitting their paperwork and on time and meeting all their work requirements and make sure that you're getting paid for the care that you're providing. So it is absolutely going to have a serious ripple effect across the FQHC
Yeah.
community.
And so how would health tech company think about that? You've sort of answered it already, but let's drill into that a little bit more. And one of the reasons why I'm thinking about this way, the question the way is because what reminded me to have you on as a guest is you posted a LinkedIn post about how vendors deliver their message and how they can fumble it. And it
Mhm.
resonated with me because I see a lot of those same things happening. So I thought this is a good topic to cover. So like elaborate if you would.
Yeah, absolutely. Well, I think a lot of times it's everybody thinks they have a great product and many of the products are great, but you have to think about like what problem are you trying to solve, right? And are you trying to solve the problem that the health center has? Because they could have millions of problems, right? And to your point, it's really has to hit that business use case example, right? You have to be able to show that is it going to have a clinical impact? Is it going to have a financial impact, right? If the health center has to lay people off, is your product going to help support them? Or will they not be able to manage your product once they lay off a bunch of people because it's so complex? And so I think there's a lot that happens in that space where people are just sort of disconnected from what's happening. And we sort of joke sometimes we call it I joke with a colleague, we'll call it vendor breath, right? Or sometimes right where they're like not really quite getting it. Or an old IT director of mine used to call vendor salespeople ankle biters, right? Because it's just like kind of thing. So what you don't want to be is that person, right? Who's
Right.
kind of tone deaf, not really listening to what's happening. And a lot of sometimes these products can be developed for these larger hospitals, right? And they're not really developed for a community health center environment to be managed in a community health center environment space. And so that's a real big piece of this. And it's also because health centers have a tighter budget, less room for error, they have to be more thoughtful and careful about the products they're bringing in, right? Because they don't want something that's going to end up costing them more money or costing them more money than they expect. They want to see a product that's going to give them that ROI on their product. And I think that's a big important factor that people don't always think about, right?
Yes, I think that's one. Another one that I spend a lot of time addressing is how much of a lift is it going to be? Like like you've gone through an Epic implementation, and so Epic's in a luxurious position that they're a quasi monopoly now,
Mhm.
and so I hope I'm not offending anyone when I say that. But and so people basically have to buy Epic, and so they can endure the rather elaborate and costly and timely
Mhm.
implementation process that it takes. But most other vendors don't have that luxury, and so they really have to find ways to convey to the customer that, hey, we're going to shoulder the effort as much as possible and get the customer to understand that here are the things that you'll have to do. And the brunt of the work, we're going to carry as much as possible. And maybe that's in the design of the product or the solution, so it doesn't require a lot of effort. But that to me is one of the things that really will derail a sales opportunity or a solution is it's too much effort given the fact that they're juggling all these other projects and responsibilities that they already have. And
Mhm.
so to me, that's one of the big ones. And folded into that is the risk that it may fail.
Yeah. Yeah. No, I think you're 100% correct around that. And I think sometimes people may see something as a good product, but they're like, we don't have the bandwidth to take this on.
Right.
And I
Right.
think it can be a big turnoff for a lot of organizations. And that's where we've also done a lot of work as well, particularly in the AI space, where a lot of health centers were interested in implementing AI, but just didn't know where to start, didn't know how to evaluate vendors, or didn't know how to implement. And so we've actually I've been able to sort of sit in that space between the vendor and the health center and actually help those AI implementations be successful long term because we understand the complexity in the health center. We understand the vendor and the product and what they're trying to do. And we could sort of be the translator. We're like the Google translator in between, right? The two different languages that we're sort of translating in between the two organizations. But I think you're right. And oftentimes what happens, I think, is that the vendor will use some words and the health center hears those words and they think they understand what the vendor is saying. And then either that miscommunication causes the sale not to go through, or it's the opposite. They hear the vendor say, oh, you integrate, and they don't really ask a lot of questions. They immediately assume that product can plug and play
Right.
into Epic, and it
Yeah.
doesn't, right?
Yeah.
So
Right.
then you buy it and it doesn't, and then you realize there's so much more work to it. And that's when relationships can kind of become strained between the vendor and the health center, or those costs, right? Those costs, the surprising costs that kind of come down.
So let's dive into AI for a minute. Where are the best initial places to consider AI in a healthcare setting? I mean, like how would an FQHC or a rural hospital or any hospital or provider say where is it easiest or best for AI? Because one of the things I'm seeing is in my world is they're just overwhelmed with choice. Like
Uh-huh.
it's as I've said before, and others have probably said, this is the Cambrian explosion of solutions now because of AI, and they're just what can I focus on? So, look, give us some insight as to where you're trying to direct your customers and healthcare delivery enterprises. Where should they start?
Yeah, and I think you're absolutely right. There's so much noise in this space right now that it's hard to sort through it. Right, you get so many emails every day from
Yeah,
somebody selling something,
yeah,
right? And
yeah.
thousands of people doing the same thing. It's like when you go into the store, you want to buy a pack of gum. You're like every flavor possible, every packaging
Right.
possible, right? It's like which gum do I
The
choose?
paradox of choice.
Paradox of choice, right?
Yeah.
Absolutely. So one of the ways we sort of help organizations think through this is that we've developed what we call use case prioritization. So instead of just saying like, wow, that's a fancy new AI tool, let's go buy it. It's more about like, what are we trying to solve? What's the problem that we're trying to solve? Do we have friction in our call center that we're trying to deal with? Are we trying to support wraparound at home services? Are we trying to help reduce providers' time in scribing? So let's come up with all the areas that we're trying to target. And then let's prioritize them based on a number of different criteria that we laid out. And that just kind of helps them get to an area where like, this is the area that we really need to look for a product to support us in. And whether that's augmentation, whether that's addressing workload, whatever it might be, expertise. And then from there, they could say, okay, let's say we want a call center. We know that that's our friction point. All right, now let's go out and let's find some vendors who are in the space and let's go the process of vetting them, right? So then that's the sort of the second step in that process there. So, and then there's a vendor vetting process in there that they want to go through, and then sort of making the decision, negotiations, implementation, right? There's a whole bunch of steps after that. But
So
yeah.
this is that like if you're a salesperson, now I'm talking to people listening to this. If you're a salesperson, what you should do is roll that last section back. And then that's kind of how you should sell. I mean, you're going in as a consultant telling them how to do their work, right? How to think about this, how to think about the project. And really good salespeople do exactly that. They go in not as a salesperson per se. They go in as someone who's consulting almost independently of their product or the solution and saying, hey, here are the things that you need to take into account as you go. So here are the steps along the way. This is what I often call the customer journey, right? And you're really acting as a consultant to them. So you've just kind of very articulately explained these are the things that the customer should be thinking about. Ergo, these are the things the salesperson should be addressing proactively.
Absolutely. You hit it on the head. It's really about having those conversations and doing a little bit of that fact finding, because if you go into an organization, let's say you're selling a, I don't know, scribing tool, and that's not their pain point, they already have one. Like,
yeah,
it doesn't make, right. There's no fit, right? And you lose trust if you're trying to push your product on them, right? So, and then let's say their AI scribing tool doesn't work out, they're not going to come to you, right? Because you've already lost that trust, right?
Right.
So it's really around like you're absolutely right. It's around having that conversation, like, where's your gap like right now? What's stressing you out? Where's your need? What are you worried about? What's keeping you up at night, right? It's about asking those kinds of questions and sort of seeing if there's a fit, right? And see what's on your strategic plan, what's on your roadmap. Are you adding a new service? Are you opening a new health center? Are you actually closing sites, right? Are you laying staff off? Like, what's going on? Like, you're having to lay off some staff. Oh, you're laying off some staff in your XYZ department. Oh, how are you going to get that work done?
Yeah.
No, right?
Yeah.
Oh, well, guess what? We have actually a product that does that, right? So, right, you sort of have to like sort of always bring it back to what their pain point is.
Right. So getting back to now the question, let me get back to AI. Where might they like start to play around with? I mean, obviously scribing tools that's kind of low hanging fruit, as you will, if you will. Like, what sorts of things are particularly intriguing and relatively safe territory to cut your teeth?
Yeah. So some of the areas where I'm seeing the most traction. So in the clinical area, like scribing is just huge.
Yes.
Outside of that, people are reluctant to go a little bit deeper in that because people are very afraid around the clinical decision and not making the right decision and liability around that.
Right.
So there's some nervousness around that. I think a couple of other areas where we're seeing people really gain some traction and get interest from organizations are around some of those operational and financial areas. So we talked about the call center agents, huge pain point in organizations, call centers. And so health centers are absolutely looking for ways to tap into, AI products that can help address some of those pain points. Another area is around coding and billing, right? Because you don't want to leave money on the table, right? Who wants to do that, right? So looking for products that can help do a better job with the coding and billing and being more efficient about it, helping reduce denials. That's a big one. Prior authorizations, huge area for people, such a time waste. Referrals, another big area. That's a time waste. So,
and in rural areas or anywhere except like the big metropolitan areas, getting the staff finding staff that is knowledgeable, understanding DRGs and all the ramifications of a given bill and the clinical report and so forth. That is incredibly complex stuff. And so it does lend itself. And you're right, denials and prior auths are just a enormous hassle especially for underserved organizations, and FQHCs would certainly fit into that area.
Yeah, absolutely. Those are big. Another several areas that we're seeing some work in language interpretation. That's a huge one, and that's a big expense for many organizations using either staff to translate or hiring external companies. Very expensive. That's a big one. And then we kind of touched on this one a little bit too, is Medicaid and insurance redetermination. So making sure patients are staying covered because that's reimbursement.
Yeah. I mean,
Yeah.
that's to me a no that's kind of a no-brainer just because just the sheer complexity of it. Where do these implementations tend to get hung up?
Yeah, it's a great question. I think a lot of it is oftentimes health centers may not have the bandwidth to actually implement. They buy the product, they're excited about it, and then their plates are full. And then they just kind of can't really move it forward. And so that's where I think there ends up being some friction and frustration because they just don't have the internal capacity to make it happen, or they don't have the external expertise. And so they sort of look to the vendor, but the vendor doesn't really have that expertise either. And so I think that's a big one. I think making sure it keeps on task. If you have to do any sort of integration with another product, let's say you're integrating with your EHR, oftentimes health centers don't consider that or think about that or think like it may take 4 to 6 weeks to make that happen. So that's not factored in. There could be additional cost to integrate into that. I think the other piece of this, they don't have project management or people to kind of keep it right on task. And so
Yes.
that's right. That's a big one. So things are not moving forward as well. And those are all some of the areas. There's several other areas that we're seeing too, but those are some of the bigger ones, I would say.
One of the things that I often Yeah, those are all excellent points, and I
Hmm.
totally agree. And
Hmm.
again, if you're a salesperson out there or you're a founder or
Hmm.
executive that's involved in the sales process, these are important things to kind of
Hmm.
anticipate and address in the sales process because if you can address them effectively, you can not only get that as a customer, but
Hmm.
win the customer, but you'll also much more likely to make them a successful customer, and that's what we
Right.
ultimately all want. So I think those are some of the things that I would anticipate. And the one thing I would add is the people that end up buying the solution, that buy into and make the decision are oftentimes not the people that benefit from the solution or that use
Right.
it. And so it's really helpful if in the sales process and in the account management process is to get the people that are actually benefiting or using the solution to buy in and ultimately hopefully become evangelists for its success and use.
Yes.
Because if you can get those people to recognize the importance of what they're of what you're delivering
Hmm.
and enjoy it and also provide feedback, you really are setting a stage, you're creating the foundation for a very successful
Hmm.
customer,
Hmm.
and that successful customer can be a referenceable customer, and they can will end up buying more services, will point out new features that you ought to have in your product, et cetera, et cetera.
Hmm.
And then you've got that sales flywheel that I'm
Right.
looking for in my customers when I consult with them.
That's exactly right. I'm absolutely a firm believer of having representation around the table when you're looking at products. I don't, and I just don't believe that like it's one person's role to go and vet a product and then bring it back and say we're doing this because you absolutely have to have the buy-in, but also the expertise of your colleagues, right? So if I'm looking at a product to do billing and coding, I better have my billing and coding person there,
Yeah.
right?
Yeah.
Because I don't know the questions to ask,
Right.
right? I don't know
Right.
the complexities in that, and I also want them to evaluate it alongside me. I want them to feel comfortable with it, so that if we do decide to go forward with the product, they've already bought in. They're part of it, right? It's not just me saying, "Hey, hey, Mary, we bought this product. Now we're going to implement it," and have them be like, "Wait, what is going on here?" Right? So that's where I see things just stall.
Yeah.
Right?
I
So yeah.
my personal experience is very consistent with that, and that is I I started out selling in telecom to
Hmm.
AT&T Bell Labs years ago, and then from there went to Wall Street and sold into Wall Street and the financial
Hmm.
trading houses, and then moved into healthcare in some kind of weird set of circumstances, and been in that for a long time. And there's no comparison to me
Hmm.
in terms of the kind of the consensus-driven decision-making that takes place in healthcare. It
Hmm.
just doesn't exist in the same way in the industries that I've been familiar with. It's much more likely that some group will here's a top-down, we're doing this.
Right.
But in healthcare, man, you can have people that are basically in charge of just doing billing,
Right.
and they can kill a decision that the
That's
head of revenue cycle management wants to have.
you're absolutely right, and I've seen that happen in organizations. Like somebody was upset that they weren't involved, and they killed it, and it
Yeah,
was a great product and could have
yeah,
helped the organization, but because
yeah,
they weren't involved in it, it just went nowhere, right?
yeah,
So
yeah,
And conversely, I would say I've seen it happen where, let's say it's, I don't know, there's an AI optometry product. They go out and they reach out to the optometrist, get them all excited about it. They sign the deal, and then they come back to the CIO and say, "Hey, we bought this product. Go implement it." And the CIO, the technology team's like, "What is this? We weren't involved. We have no idea." Right. So, and I've seen that gets
Yeah.
squashed. Right. At that point too. So, and I think as the vendor it can be a little hard to say who else should be at this table, but might help you out in the end.
Look,
Yeah.
I'll be emphatic about that. That is absolutely one of those questions that you have to ask, and not once. You have to ask it several times
Right.
throughout.
Right.
Who else weighs in on this?
Right.
Who else gets a say?
Right.
Whose ox gets gored
Hmm.
if we do this,
That's right.
right? And then you got to go and talk to that person whose ox is, and then understand because one of my philosophies in this is have no enemies, right?
Yeah.
They
Yeah.
don't have to love it, but if you got an enemy, it's an uphill climb at that.
Yeah. Yeah.
Right.
Yeah. I agree with you. And then it's like you signed a contract and it's going nowhere, right?
Yeah.
Nobody wants that.
Right.
Who wants to, people want their product to be used, right?
Yeah.
And
Yeah.
so, and sort of leaves a bad taste in everybody's mouth. So I think like, and that's hard sometimes, I think, particularly for salespeople, because they want to make the sale and they're just like, they want to get it signed. And the easiest path to get it signed probably is like having one person sign it as opposed to everybody. But in the long run, it's not going to make your product successful. And I think that's what people really want to get to at that point.
Yeah.
Yeah.
I'm just as a tangent.
Yeah.
One of the things I would do, I would make it clear to the customer team, hey, that
Hmm.
we're gonna have a celebration dinner.
Hmm.
And I would invite like a wide range of people. It could be
Hmm.
a very expensive
Hmm.
dinner, right? But we would have users there, we would have managers there, and we'd have the senior executives all at
Hmm.
the same thing. And it was amazing when you could get that together because all of a sudden everyone's like, oh, they're all kind of bought in, number one,
Hmm.
and then the users, the people down in the trenches, so to speak, they may never have met the
Hmm.
senior exec or the CEO or the COO or whoever who signs
Right.
off on the deal. And so it's really an opportunity to kind of build this sense of, hey, we're all in this together.
Right.
And it's amazing what a difference that can make in terms of the success of a project. If everyone feels
Absolutely.
like, hey, the vendor's really bringing this in and they're making us all
Hmm.
feel like we're all invested in this thing.
Right.
Yeah,
Yeah, absolutely. Absolutely. And the other piece of this too is when I'm vetting a product and we're working with an organization, they're vetting products, and we start to sort of whittle it down to like maybe the final candidate. I always like to check references, but I do that for a reason. And I know vendors are cherry picking their references. Obviously, we know that. But there's a couple reasons why I like to do that. One is like, can they produce references?
right.
Right. And you'd be surprised at how many times I'll say, can I have references? And it's like radio silence.
Yes.
And that's a signal to me
Yeah.
immediately.
Yeah.
Like, what is going on there? Like, did you, are you brand new? Like, tell me you're brand new. You don't have references. We're going to be your pilots. Like, tell me that, right?
Yeah.
I'm okay with that if that's the case,
Right.
right? But give me some references. You can't give me references. And I usually like to say, give me three. Not that I'm going to always call three, but I want to know, like, can you
Yeah.
produce three
Right.
references, right?
Right.
And so when that's like pulling teeth for me, that worries me, right? That immediately gets me concerned that something else might be kind of going on there. And I like to have conversations with the references. And I find I've been able to have very frank conversations with the references
Sure.
oftentimes.
Yeah.
You could frame questions in a very particular kind of way. And it's not that you're trying to find something wrong, but you just want to know, like everything isn't roses, right? There's going to be some
Right. Right.
challenges along the
Right.
way, right? Tell me what the good things are and tell me where there are some opportunities, right? With the
Yeah.
product. So,
Right, this is a big part of what
mhm,
I focus on with
mhm,
my customers, and not to make this a sales pitch or anything, but I really I spend a lot of time getting them to understand that it's about retaining the customer and customer
right,
success. And that
right.
customer success, part of that is managing expectations, but it's also part of that is having the infrastructure and processes and
Mhm,
resources in place to reinforce that
mhm,
success.
mhm,
And that doesn't mean there aren't going to be bumps in the road. There definitely
right,
will be. But if what they are, and you can tell the customer ahead of time, this is when you can expect to have, this is
mhm,
where we get caught up. This is
mhm,
where problems can arise. And this is how we address those problems to make
right,
sure they don't happen. And that sort of thing. And and one of the things I want them to do on the tail end of that is, hey, listen, when you're successful, this is going to be a success. We're going to win. You're going to be successful. You're going to be happy.
right,
When that happens, one of the byproducts of that is you help us get the next customer.
That's right.
You
That's exactly right.
and they will want to do that
That's exactly
because
right.
it's insurance for their ongoing success with you, right? If
Ab-
you and that's
Absolutely.
that to me is fundamental to how you ought to be thinking about this. There's a lot that goes into that. We won't dig into it there, but but there are a lot of things that go into that kind of happen that help your account management. There are
Hmm.
things in place, questions that you ask, and
Hmm.
setting up for case studies and things like that.
Hmm.
Also, and
Yeah.
the other point I was going to make real quick on this is that to your point, it's not all a bed of roses, right?
Hmm.
That everyone's you're going to have glitches along the way. What
Right.
the customer wants to know is, they fix them and they're responsive and they're
Hmm.
in your corner.
Hmm. That's exactly right. Yeah, and you made like a number of really great points there that I want to really expand on too, because like thinking about your current customers being a voice for you with other
Yeah,
customers,
right,
that is 100% correct, right? Let's say when you're thinking about leadership, health centers anywhere, you don't become a CEO or C-suite person because you're not competitive, right? If you bring a product in and you're doing it well, you want to tell your colleagues that so, hey, we just brought this product in and we've got a 75% call answer rate resolution and we're patients are happy, providers admit it. You want to tell people
right,
that you're like you just hit the grand slam. You want to tell people, right? So
right.
they're going to absolutely be your best reference without you even having to ask them. So and that relationship piece is huge. I have found vendors that I will kind of keep going back to or bringing them to other organizations when I see how they operate, right? When I see that they mea culpa and they say like that was our bad, we didn't do this right, we didn't do this well, we're fixing this, whatever it might be. When I see them also just take responsibility, that's very meaningful to me because I feel like it's not just about another sale to them. They actually care about their product and they care about their customers. And that's what I really want to see from a
Yeah,
vendor. I want to see that they care.
yeah, and I've experienced this firsthand, and that is, you get the right level of relationship with your customer,
Hmm.
they may come to you with a problem.
Hmm.
And if you can say to them, "Listen, we can help you with it. It's gonna be new ground for us.
Hmm.
And, we can leverage these skills that we have. We leverage our platform and so forth. We're going off and building something new." There's a really good chance your customer will go, "Well, what? I know who you are. I know how you behave. I know what I can rely on you. I'd rather go with you than try and shop it with somebody brand new." It's the devil you know,
That's
right?
You're exactly right about that. It's
Yeah,
so true. And over the years, like when I was at Fenway, we were a very early adopter of technology. We were doing portals back in 2014, a time when people didn't even have EHRs implemented, right? 2009. And I think there was one point I counted, we had nearly like 30 different types of products kind of bolted on to try to get us where we needed to go.
yeah,
Thankfully, I'm not living in that time anymore. But you're 100% correct. When there was a problem I wanted to solve and I had a good relationship with a vendor, maybe it's not something they did, but I'd say, hey, what we're trying to do this thing. Is that something you could do? And because you had a good relationship, they'd say, well, we're not doing this yet, but I think we could do it. Like, let me get back to you. Right. And you sort of, because you have that trust in them, right, you feel like even if they've never done that before, they'll be honest with me. Right. Or they'll say, what, out of our scope, we really can't do that.
right.
And like I said, I've brought vendors to different places with me because I feel like I trust them. Right. Trust
Yep.
their product.
That
Most
is, I
cases.
think, that is the objective ultimately, and that's where having a good fit and being cold-eyed about it when
Hmm.
you go in and being able to assess and
Hmm.
basically act as a consultant is really an asset for salespeople. So,
Yeah. And the other thing I want to add to that too is even that sort of first initial interaction, being on both sides of the table, being on the CIO side and being on the other sales side, it's a very interesting perspective
yeah,
because I'm sort of evaluating, right, both from both perspectives. But the people who I've seen be successful, or at least make it to maybe a second round or second conversation, and vendors are the ones who actually do some work ahead of time. I've sit in calls where a vendor will come in and they'll pull up their PowerPoint and they just rattle off. They don't really ask the customer anything, right? They're just going through their PowerPoint deck and this is what we do. Look how fabulous we are versus other vendors who will say, it came in, hey, I saw you're located in New Jersey. I see you have 4 sites. I see you serve 50,000 patients. I see you are blah, blah, blah. It's like a job interview, right?
yeah,
If I'm interviewing Brendan as a candidate and I say, hey, Brendan, what do you about my company? And you say, well, I don't really know much. Okay, that's like mark against you. You didn't even have the time and effort to go in, right, and do a little research about it. So I also want to see a vendor who's actually put in a little effort to learn something about who we are as an organization. And a lot of the conversations that I have with health centers after vendor demos are like, they got us, right?
Yeah.
That vendor got us. They
Yeah.
understood FQHCs. They got us, right? And that can mean many different things, but it
Yeah.
was always like they understood, right?
Yeah.
And that immediately bumped them to the top of the list as a potential option.
Right. Well, I
Yeah.
started out by asking you, how do they get paid?
Yeah.
Because if you're calling an FQHCs, for example, you want to know how do they make their money, what their costs are. Like you need to know those things. You
Hmm.
can't go in and have them educate you on that.
Right.
I mean, you can dig into it once you get on which ones matter the most, so that you can get it like to that.
Hmm.
Like what specifically is your organization running up against? The other thing the last podcast I just did, which is kind of another kind of layer to this, is what's the regulatory environment in that state? And because one of the points I make in the last podcast is that this is not a country that's got one health
No,
plan, right?
no.
It's like one.
Yeah.
Every state's got its own regulatory environment. New York and California are particularly aggressive in terms of regulation. Wyoming and the South tends to be very lax. And so, what sorts of regulatory homework can you do before you go in and talk to
Hmm.
that particular customer? Like, what are they up against? What do they have to? What compliance hoops do they have to run through? Those sorts of things. That's
You're
another layer.
absolutely. And just to kind of even give you an example of that. So last fall, the Coalition for Healthy AI, so Chai put out a policy brief where they looked at all of the AI policies that state policies that people were putting forward. And they had at that point, and it was like something like 200 or so that had reached state legislators across only 40 states. So that gives you an indication of what's happening. It's so inconsistent in terms of what's happening. So you're exactly right. Some state Medicaid say you can't use AI scribing to a doctor for notes. Some say it's fine. So you 100% need to know what's happening in that state because they may not be able to use your product. And so
Right.
why waste everybody's time, right, at that point?
Exactly. Yeah.
Yeah.
Yeah. So
Yeah.
basically, to kind of wrap this up a little bit,
Yeah.
what we've established is that healthcare is particularly
It's
complex.
complex. It's absolutely complex.
Well, but the beauty of that is, as you're able to navigate that at some level of
Right.
expertise,
Right.
you really does differentiate you.
Yes. Yeah. Well, I always think the satisfaction comes to me when I bring in a product and it goes well, is having the implementation team be happy or hearing some of those downstream stories about somebody who's on the front line registering staff and saying, oh my God, this product has like saved me so much time, so many headaches. Or hearing a story about a patient who says, oh my God, it's so easy to log into this new portal now and request my medication. Like that's what makes me happy to hear and feel like the product is actually doing what you want it to do. And like that's the goal, right? That's the goal to get to that, right? And it's almost like starting with the end in mind, right? And then kind of working backwards on those issues. So
Absolutely.
yeah.
Well, Chris, thank you so much for your time. This has been fantastic. There's a lot here for the audience, and I really appreciate your expertise and knowledge in this space. And it's kind of very unique and varied, which is like to your point that both on the buyer and the seller side. How do people reach out to you? What's the best way to contact you? And what else? What would you like to leave the audience with?
Yeah, thanks so much. Well, firstly, thank you for having me, Brendan. Fabulous conversation. This is such an interesting time living in. Things are moving so quickly.
Yeah,
Definitely have to keep on your toes to keep up with it. So love to come back sometime and continue and
of
see where
course.
things are 6 months from now. They'll be very different. But if people want to reach me, they can reach me at Chris, so CHRIS at fastxpartners.com. Email me there. They could go to our website, fastxpartners.com, and send us a message there as well. I'm on LinkedIn. Always reach out to me there. I'm happy to connect with anybody on LinkedIn. Chris Grasso. Find me there. We have Instagram account too. So lots of different places that
Excellent.
people can find me. We're going to be at a couple of conferences coming up over the next few months as well. So if you're at those conferences, come find us. We'd love to talk to you.
Very good.
Yeah.
Well, Chris, thanks again. And to you listening, thanks for listening. And another episode of Let's Chat Health Tech. And we'll let you get back to your day. Happy selling.
Great.
Bye bye.
Bye.